Now, another place that we are challenged with imaging in another area, because of infrastructure, I've told you, is a big challenge in Africa. So the imaging, what is commonly available is ultrasound. Okay, is available in all the countries. CT scan is available, but you see some of them 64 slides, 32 slides. We have a few 124, 128, and a little more advanced CT scan. Bone scan is like a country, Nigeria, with over 2 million people. There are only 2 bone scan facilities, isotope bone scan facilities. Until last year, there was no PSMA MRI PET scan. We just have one now. Okay, so in South Africa and North Africa, they may have a few more. Okay, so but imaging is one of the things that we have to consider if we are also going to, before we biopsy the patient. It's the biopsy that will confirm the diagnosis. Now, a few centers now have multi-parametric MRI. Okay, so where they are available, they will be very useful in guiding diagnosis. And what we advocate now is that they should do MRI even before biopsy, if there is any indication for biopsy. But before I continue on imaging, let me now focus on biopsy. Okay? Yes. So the biopsy, if we have indication for biopsy, that would be abnormal digital rectal examination, relatively high PSA, abnormality on imaging. And so we'll decide to do biopsy. Now, to do biopsy of the prostate, where the facilities are available, we will recommend multi-parametric MRI-guided biopsy, whether targeted, which is preferred, or non-targeted. However, there's only very few centers that will have this in Africa. Now, the gold standard in Africa then is ultrasound-guided biopsies. That's the gold standard for Africa, in most places in Africa. Now, we do extended biopsies. We do systematic biopsies. A few centers do saturation biopsy, the problem of infection and all that. And recently, a few centers have started doing transperineal. Traditionally, we were doing transrectal. Okay, ultrasound-guided biopsy. But we advocate that you can migrate to transperineal to reduce infection. But it will shock you that a lot of places in Africa still practice digitally or finger-guided prostate biopsy. Now, it may sound shocking, but the prostates that come to us, a lot of them will present as stage 3, T3, T4. So, in as much as we need image guidance, but where you don't have MRI, you don't have ultrasound, transrectal ultrasound, would you rather leave the patient without anything? So what I'm saying, until such centers have ultrasound-guided biopsies, they can still be doing with digital. We know it is not accurate, but that is what is available. So that is the biopsy. Now, there may be need for repeat biopsies when you discover that the PSA is high, there is suspicion and abnormal digital rectal examination. However, the specimen that you have gotten did not suggest that is malignant. Or you have high-grade PIN or some assignment pattern that's not so clear. So there may be need to repeat biopsy. So with addition of imaging, biomarkers, genetics, then they can help you to improve or the chances of recommending repeated biopsies. Okay, so that is for biopsy.